Kaposi sarcoma. Definition: Kaposi sarcoma is a vascular neoplasm of multifocal origin, described by Maurice Kaposi in 1872. Since then, 4 clinical forms have been described: classic, endemic, iatrogenic, and associated with HIV, the latter being the most frequent one that is frequently observed in patients.
Topic. In Kaposi sarcoma, we'll abbreviate KS, and it is a vascular tumor. And this tumor is malignant, and most commonly it occurs in patients who are immunosuppressed. And when an immunosuppressed patient is infected with a certain virus, you most likely will develop Kaposi sarcoma, which is that tumor. And that virus is human herpes virus type 8, or abbreviated HHV8. Now, when I say immunosuppressed patients, what type of patients are we talking about? Well, very commonly AIDS patients who have very low immune system, and also patients who are at risk of developing HIV and AIDS. So patients, for example, who are IV drug users, such as heroin addicts. And another category of immunosuppressed patients are patients who are organ transplant recipients. Due to the medications that they're on, their immune system can be suppressed.
Application in nursing. Application of fully proved medication administration, psychological support, emotional support. The literature describes the following options to treat the classic form: local surgical excision, cryotherapy, electrosurgery, chemotherapy, laser therapy, and radiation therapy. Pros and cons. Pros: having protected seawall relation avoids the type of pathology. Avoid polygamous relationship. Reduce sexually transmitted disease. Cons: fibrosis of the body of the penis, erectile dysfunction, and new lesions in areas not treated may be observed.
The last herpes virus we're going to talk about is HHV8. It's a gamma herpes virus like EBV, and using similar mechanisms to EBV, it can cause cancer. Now, it's known for one cancer in particular, which is that in patients with AIDS, it causes something called Kaposi sarcoma, which is a neoplasm of endothelial cells, and it has a very distinctive appearance with violet-colored plaques that can appear on multiple sites of the body, like this, and can also appear within multiple organs. For the most part, it's disfiguring rather than life-threatening, and usually it resolves as the AIDS is treated with antiretrovirals. But the exception, which is pretty rare, is visceral Kaposi sarcoma, which is life-threatening and does require chemotherapy in addition to the antiretroviral therapy. Kaposi sarcoma was actually known before the HIV epidemic, but it was much, much less common. And patients who would get it were usually older males living in places with higher rates of HHV infection, including Africa and the Mediterranean. We still have a lot to learn about HHV8, including how it's transmitted and how to prevent infection. But the important thing is to be able to recognize Kaposi sarcoma if you see it and know that
Issue apply in Ecuador. Sarcoma of Penile are very uncommon, representing less than 5% of malignant tumors in this area. At the Luis Bernaza Hospital annually, an outpatient dermatology clinic is seeing approximately 6,000 consultations.
The last type of Kaposi sarcoma under epidemiological classification is the acquired immunodeficiency syndrome associated Kaposi sarcoma, or simply we can call it as AIDS associated Kaposi sarcoma or epidemic Kaposi sarcoma. So it is AIDS associated Kaposi sarcoma, or we can say epidemic Kaposi sarcoma. AIDS associated Kaposi sarcoma or epidemic Kaposi sarcoma. So the name itself says that AIDS is the one which is the culprit in AIDS associated Kaposi sarcoma. And this AIDS associated Kaposi sarcoma often involves lymph nodes and disseminates widely to viscera early in the course. So initially involve lymph nodes, right? Initially it involves lymph nodes and disseminates widely to viscera in the early course of the disease. Viscera, that is early course of AIDS. In the early course of
Conclusion. Kaposi sarcoma is an important cause of morbidity in HIV-infected patients. Kaposi sarcoma of the penile can affect both HIV-negative individuals as well as HIV-infected individuals.
Now, let's get technical. Leading her research team in understanding the molecular basis of Kaposi sarcoma. Kaposi sarcoma is the most common HIV-associated cancer and it lacks specific treatments.
Kaposi sarcoma, or KS, is associated with the herpes virus.
Leading her research team in understanding the molecular basis of Kaposi sarcoma. Kaposi sarcoma is the most common HIV-associated cancer and it lacks specific treatments. Kaposi sarcoma, or KS, is associated with the herpes virus.
Really increased substantially in incidence with the HIV epidemic. So with the introduction of antiretroviral therapy, we have seen the numbers come down, but there's still problems. So we don't fully understand why certain people get Kaposi sarcoma and others don't, because not everybody who's HIV infected will get the cancer.
South Africa has made huge strides in getting people to test for HIV. However, 86% of people are not aware of their status, and over 100,000 people die from AIDS-related deaths annually in South Africa.
ARVs are not the solution, or at least they're not the whole solution to treating KS, and we still need a greater understanding of the biology, and then we need to use that information to try and find new therapies that specifically are targeting KS rather than treating KS through, HIV-targeted antiretrovirals.